My name's Juliet Bourke. I'm the Chair of the Task Force on Care Costs.
And I'm Gabrielle Upton. I'm the Deputy Chair of the Task Force.
And today we're going to talk to you about the cost of care, the government response to the Task Force, and what we think you can do to make a difference.
Juliet, why is it that the Task Force is lobbying about the cost of care?
Over the last 3 years, our research has shown that the cost of care is just too high. Cost of care for a child, cost of care for an elder, cost of care for a person with a disability. 37% of Australians feel that the cost of care is too high relative to their income, and that's up from 31% 2 years ago. Not just about people's feelings though, it really is about the cost of care. Our Care Affordability Index tells us that over the last 5 years, the cost of childcare has risen by 65%, and yet people's disposable income has only risen by 17%. So there's a gap. What does that mean? It means that when people sit around the kitchen table doing their maths, they work out they can't afford to work anymore. So people pull back from the workforce. They exit or reduce their hours. It's not what they want. It's not good for them. It's not good for business. It's not good for the community. So the Task Force on Care Cost didn't just define there's a work cost of care crisis. We also looked for a solution. We asked people, what would that solution look like? 75% of Australians with caring responsibilities told us it would be the equal sharing of care costs between themselves and government. So that is the Task Force proposal, that the government reimburse 50% of people's out-of-pocket care expenses. And that solution means that the government needs to take action. So Gabrielle, what do you think of the response so far from the government?
Well, the government received the Task Force's report in October 2006, and we've had individual statements of support from various politicians. They're listening, and that's absolutely great. But there are mixed messages about the issue as to whether there's a work cost of care crisis. Just 2 weeks ago, Treasury received a report, and that report said that childcare in particular is both accessible and affordable. But in fact, the work that the Task Force has done indicates that childcare could indeed be much more affordable. We're also going to wait to see the outcome of the 2007 budget, and we're hoping that the government will provide for the Task Force's reimbursement. The Task Force, of course, is made up of community and business organisations, but if people really want change, what they need to do is go out there and talk to politicians directly.
I think that's right. I think that Australians need to communicate directly with politicians. They need to tell politicians, both those in government and the opposition, how it really feels to be managing work and care. And the Task Force on Care Costs is helping people to do that. Go onto our website and have a look at the e-cards, the electronic cards that you can send directly to a minister in the government or the opposition. You can send that message to the Prime Minister, to the Treasurer, and tell them how it feels and that the solution is the reimbursement of care costs.
But you can do more. You can pick up your phone and talk to your local federal member of parliament. You can send them a letter, you can send them a fax, and you can urge your friends, your relatives and your workmates to do the same. You can hold meetings and talk about the issue and make sure that the message gets out there like wildfire. And remember, one thing is clear. Each of us, at some stage in our lives, requires care. So get active and show that you care.